So you heard it from Jonathan. It's that easy, right? But let's bring in our guest to tell us how easy it has been managing the whole issue around blood donation in the country. Let's welcome Professor Sale Yuguda, Director General, National Blood Service Agency. Thank you very much for joining us, Prof.
It's a pleasure for having me here. Thank you very much.
All right, let's begin by looking at the margin. Nigeria is said to need about 2 million units of blood to meet, the growing demand. And we're seeing shortage in the donation of blood. What are you doing about it?
Thank you very much for having me here. First and foremost, let me congratulate Nigerians for celebrating this World Blood Donor Day. And World Blood Donor Day is celebrated every year on the 14th of June. This day is set aside by the World Health Organization in order to thank all those that have been giving blood voluntarily, and also to encourage others to join the bandwagon of donating blood voluntarily. So as we have already seen in the reports, Nigeria has a very wide shortage of blood in the country. And this is based on the fact that most of us are not willing to come out to donate blood voluntarily. And this is impacting negatively on most of the things that the management of most of the elements that we are supposed to be doing in our hospitals. For example, whatever you are going to manage, be it accident victims, maternal mortality, childhood diseases, under 5 mortality, all these ones at one point or the other requires blood transfusion. And based on the statistics, you will agree with me that maternal mortality, that's death from pregnancy and childbirth, accounts for the lack of blood transfusion accounts for up to 40% of such deaths. When you look at the accident victims, about 30% of them die due to lack of access to timely access to blood transfusion. At the same time, when you are talking about management of cancer, management of childhood diseases like severe malaria, sickle cell disease, and so on and so forth. So all these conditions requires blood transfusion at one point or the other. And based on the statistics, in Nigeria, we need at least 2 million units of blood based on our population annually in order to cater for our needs. And unfortunately, we are able to supply less than 30% of that requirement. So you will agree with me that there is a wide shortage of blood in the country, and that's why we are calling on all individuals to come out and donate blood regularly and voluntarily.
Prof, it's good you've attested to the shortage, but going forward, we're looking at solution, which is what this Blood Donor Day is canvassing for. We have misconceptions from individuals who are afraid based on cultural or religious belief or just personal fear. What strategies are you adopting to break that cycle, to make people come out and donate blood voluntarily?
Yeah, thank you very much for that question. Actually, there are a lot of misconceptions across the board, more especially when it comes to donating blood. First and foremost, let me assure Nigerians that donating blood is safe. Donating blood cannot harm you. In fact, even if you didn't give the blood voluntarily to individuals that are in need, the way the nature designed our body is such a way that the blood cells themselves have half-life, that they have a lifespan where they will die within a certain period of time. For example, our red blood cells usually die after a maximum of 120 days, and the nature will now replace them. So even if you didn't give people, constantly the cells are being replaced in your body. So back to the question now. When you donate blood, there is no harm in it, even though there are just some few pains that you will feel when they are taking the blood from you, just the needle prick. And then also, when you look at it, you will not feel much, like we saw in the reports. So by the time you donate blood, you are saving lives. And moreover, we as the healthcare personnel, before we collect your blood, we have to make sure that you yourself is safe to donate blood, because we can't take blood from you when it will be harmful actually when you donate blood. So what are we doing in that aspect is that when you come to donate blood, we sit down with you, ask you some questions, basic questions about your lifestyles, and also check your blood pressure, check your weight. We have to make sure that you have the minimum weight for a blood donation, which is about 50 kilograms. So we have to do all this background to make sure that you are not on any medication that will affect your health after donating blood. And after, it's only when you are found to be fit to donate blood, that's when we collect your blood, because we also have a duty on us to protect you as the donor of this blood, and at the same time while we are trying to save lives. So donating blood is very safe for everybody. So I'm therefore encouraging people to come out and donate blood en masse to save lives.
Okay, Prof, we'll pick up with the conversation because sensitization is very key if we want to move forward. Let's take a break. We'll be back. All right, Prof, let's continue the conversation. Before we took the break and going by what we're seeing from this report, sensitization is very key. I want to believe you're also a key stakeholder in this blood donation, but it's not about you. It's about having people come in, to give this blood voluntarily. What has been the strategy for the agency to sensitize people?
Thank you very much. We at the agency, that is the National Blood Service Agency, we started this year's program from the 1st of June. So basically what we have been doing is we have been going from one community to other, and if you observe, this World Blood Donor Day sensitization program is currently occurring in almost all the states of the Federation. So we have our state offices, we have zonal offices, all of them concurrently have been sensitizing people to come out and be donating blood. So we started from 1st June, like I said earlier, whereby we have been going from one community to another, from one religious body to another. All of them, we are just preaching one word to them: please be a voluntary donor. So yesterday, we also had our road walk inside Abuja here, and today we had the mini marathon where it was graced by the First Lady of Federal Republic of Nigeria, Senator Oruremi Tinubu, who was represented at the occasion by the wife of the Vice President. So we had the mini marathon where we had many youth organizations and also women organizations participated in the program. And even there we preach one word to them, that's be a voluntary blood donor. And we are also going to continue this program until the end of the month. So the strategy we are adopting is to engage almost all the stakeholders in the country that are very important, right from our donor partners, more especially the WHO, and all the armed forces are there. They are also partnering with us. There are many NGOs that are partnering with us, also working towards this, encouraging people to come out and be donating blood. And we are also going from one religious body to another. We have been into the mosques and the churches, all of them partnering with the religious bodies in order to preach the gospel of donating blood voluntarily. Because when you look at it, donating blood is an act of selfless act where you help somebody that you don't even know. And there is no more sacrifice that you can do to humanity. And like you said earlier on, blood is something that cannot be manufactured in the laboratory. And the only way we get blood is when you and I agree to be part of this bandwagon of voluntary blood donors. And that's the only way we can achieve the gaps we have.
Okay, so let's delve a bit into the capacity of the agency. I know there's about 17 blood collection, testing, and distribution centers across the 6 geopolitical zones and the FCT. And there are plans from reports that, the agency is trying to scale up the process. So what is the update? Where are you now? Because it's one thing to have these people come in, you're encouraging people to come donate blood, and there's not enough room to, enable that to thrive.
So thank you very much for that question. So when we came on board last year, if you look at the history, the programs, the National Blood Service Agency started as a program about 20 years ago under the Federal Ministry of Health. Then the federal government of Nigeria felt it deemed to establish a standalone agency which will take care of the needs of Nigerians. And this led to the establishment of our national signing of the act that establishes the National Blood Service Agency in 2021. And then For the first time this year, under the Mr. President's Renewed Hope initiative, we have a significant increment in our budgetary allocation, because when we came on board last year, we look at the we did a mapping and we look at the baseline. We did a baseline survey of our facilities. Like you said, we have 17 offices across the country, including the 6 regional offices. So we have a very big infrastructural gap in almost all our centers. Storage was a problem, is also a problem, power supply, and also the vehicles that we are using. So this year, under the Renewed Hope initiative of Mr. President, we have a very significant increment in our budgetary allocation. In fact, for the first time in history, we have more than 30%, 30 times increment in our budgetary allocation. And what we are planning to do now is to revamp all our storage facilities across the country, that in the 17 states, and also to expand the capacity of such offices, so that each of our offices will not just be a blood collection center or storage center. It will be actually a center of reference for almost all the hospitals in the country. And we at the agency were also partnering with the Association of Local Government of Nigeria. We have already signed an MOU with the national leadership of Algon, whereby we will establish at least one blood collection and storage facility in each of the local government of the country. So that's what we are doing now to boost the capacity. And also on the issue of human capital development, we have already signed an MOU and we got the grant. We have already gotten approval. We are establishing a training center, because in Kano, actually, we are establishing a training center for blood transfusion medicine in Kano. And this is based on the fact that we observe currently there is no any formal postgraduate training center for blood transfusion, because it's one thing to have enough blood available. And the other major challenge that we have in the country is inappropriate use of the little commodity that is available for us. So we now felt that we need to train our health workers, healthcare personnel, in order to be appropriately using this blood when it's available. So that's what we are doing as the agency.
Okay, Prof, of course, I won't let you go without asking this very crucial question. You may have been asked, in some quarters, but even today, when I mentioned, this is the conversation today, the first thing that came to the mind is, I can't give blood voluntarily because it's been sold, allegedly. I'm sure you've heard the concerns of voluntary sale of, donated blood. How would you respond to that to clarify the situation?
Yeah, thank you very much. I will not run away from accepting the fact that there is blood racketeering going on in the country. We know. But what I can assure Nigerians is, for every blood that you give us voluntarily, we make sure that we use it judiciously, because we distribute this blood to the community. But one major thing that I want to explain here is that most of the hospitals, they don't sell the blood. They actually charge for the services they render. Because when you get a blood, you need money to collect the blood bags, you need money to screen the blood, you need money to do blood grouping, you need money also to transfuse that blood to the patients. So there are a lot of things that is going on in the background in the laboratory, in order to make sure that that blood that we are giving the patient is actually safe for them. So most of the hospitals, that's the money they charge. They are not actually selling the blood, collecting money for the blood itself. Because when you look at the National Health Act 2014, it clearly states that selling any part of our human body in Nigeria, including blood, is prohibited. And
so, but are you checkmating, Prof? Sorry to cut in.
Yes.
Are you checkmating to ensure that
they
are doing the right thing?
We are checkmating. Actually, we have a national task force which comprises almost all the armed forces, and then the major regulatory bodies that are involved in healthcare sector. The more especially the NAFDAC is there, the Medical and Dental Council is there, Medical Laboratory Council, Nursing Council, they are all part of the task force. So we also have the responsibility to regulate and make sure that each blood establishment in the country is adhering to the minimum set of criteria. So the method we are adopting now is to digitalize the system, we have already started. I mentioned here some times ago that we have already signed an MOU with a company, whereby we want to make sure that digitalize the whole system of blood collection, whereby we can be able to trace every pint of blood that is donated in Nigeria, right from the donor to the patient. So we are on that, and very soon we will launch it across the country.
Thank you so much, Professor Sale Yuguda. Thank you for clarifying issues and also enlightening Nigerians on the need to donate blood. Thank you very much.
Thank you very much for having me.
And if it's your first time, thinking of going to donate blood after hearing this conversation, make sure you eat first. But to know that you're giving hope, you're giving life to someone you may not even know. Let's take a break.